most other states in this country where the behavioral health care issues that we're dealing with are accelerating.
If you've ever had a family member or you yourself have been hospitalized, it's frightening.
Every day I come in and I see the amount of patients that are in the emergency room.
Our numbers of behavioral health patients have increased substantially over the past couple of years.
Between 19 and 26, every single day, people that were in our emergency rooms awaiting placement in an inpatient behavioral health bed.
Think about it, if it was one of your family members in the emergency room having to wait 5, 10, 20 hours to get on the unit, that's upsetting.
Puts very at-risk patients in a position of stating, do I even want to still stay here?
This project that we're so very proud of will help with that. It's not going to solve the entire problem, but it will fill a huge void right now that exists in our community.
Sanford Goodall campus has a historic look on the outside, but on the inside is this brand new $11 million project that is state-of-the-art. It is our commitment back to the community.
This new facility will take our capacity, which is 12 up to 40, so it essentially triples the ability of an inpatient unit to pull more patients out of the emergency department.
They're creating 2 separate units, an 18-bed unit on the second floor and a 22-bed unit on the first floor, providing inpatient services there.
We also have a 5-bed emergency department acute psych unit.
Folks who are going through behavioral health crisis benefit from group therapy and from an open and bright environment. And so the space, once you get inside and on the floors, will mimic that.
There's a lot of group rooms, there's a lot of light that is coming in these units, so it just is a very positive place to be, and it really impacts treatment overall.
It's a welcoming, warm, hospitable environment where they're going to be safely taken care of, and they'll get the treatment they need and ultimately be able to step to that next level of care.
It's a place of hope and a place where people can have an avenue of agency to move forward and feel good about themselves and get the help they need.
It takes a team to do anything, especially for something that's such a large decision as this.
Maine Health had the vision that this behavioral health hospital here was going to be really important to the growing Maine Health system.
Maine Health saw a need, Maine Behavioral Health saw a need, and they said, well, we've got this beautiful campus with people who actually want it there. So let's see if we can work something out. And people in Sanford are just happy that this is happening.
It's bringing in over 70 new positions to the Sanford community.
Patients who need help will be able to get it quicker and faster and in their community, which is a definition for success from a healthcare perspective.
Mental illness, for some reason, was this disease that nobody wanted to talk about. Now we have it in the forefront, and we're treating it just like we would any other disease, and it gives us a leg up on many other organizations and communities.
I am so excited about this because it just shows that, with the support and the teamwork, I mean, it's such a great success story.
To be able to set something up and to see it come into fruition and to see it open where you see that benefit immediately. It makes me feel wonderful.
Our health system, people want to help people, and so when you identify that need and then you can come up with a solution and then you make it happen, that's what's neat about being in healthcare. It's projects like that that really make a difference for folks.